In Texas, the most important issue is reproductive rights/sexual education because in the past 2 years, Texas has approved policies that limit what is taught in sex education and limit women's reproductive rights, such as policies that work towards banning abortions. It's important to have a comprehensive sex education curriculum in place that covers safe sex practices that include information on how LGBT people can practice safe sex as well, because it helps to lower sexually transmitted diseases, as well as sex education curriculum that covers consent and the risk of pregnancies, because this information helps decrease women's deaths. Similarly, banning abortions will lead to an increase in women's deaths and put a strain on the economy, as women are half the population workforce and most are caregivers and home managers, raising the future generation. The problem with preventing a more comprehensive sex education from being taught in schools and the legalization of abortions are the conservative mindsets and purity culture of Texas. An article by Texas Tribune stated that learning about birth control methods beyond abstinence is only a requirement in high school, where health education is an optional course. This is bad because when students don't have this information, it can lead to them practicing unsafe sex, which can lead to sexually transmitted diseases being spread. Furthermore, sex education is an important topic in Texas because as of November 2020, Texas's Education Board approves a new sex ed policy that does not cover LGBT students. In both cases, this lack of information on safe sex practices leads to the transmission of STDs. Conservatives argue minors should not be taught this in school for fear it will influence them to have sex, or in the case of LGBT topics, make them gay. However, no research has shown that exposure to LGBT topics will influence a person's sexuality. Furthermore, a study done by National Library of Medicine shows that learning about sex from lessons at school causes a 66% reduction in risk. When all teachers teach abstinence, the likelihood of STDs transmitted is higher, so it's more important to teach how to safely rather than trying to prevent it. Sexual education is effective at reducing the risk of unprotected intercourse and STIs in early adulthood. Therefore, lawmakers should pass a policy that mandates middle school through high schoolers to take a sex education class, as well as create a curriculum that mandates going over topics of safe sex from all genders and sexualities. Sex education can prevent women dying in several ways, from teaching about consent, as a study done by RAINN showed that 1 out of every 6 American women has been a victim of attempted or completed rape in her lifetime, as well as giving them the information they need to make an informed decision about giving birth, especially concerning Texas, where a study done by the Texas Tribune found that between 2011 and 2012, 189 Texas mothers died less than a year after their pregnancies ended. Most concerning is that maternal mortality is rising in the U.S. at the declines elsewhere, which studies have directly linked higher sex education with lower maternal mortality rates. Some conservatives argue that teaching young women about sex corrupt their purity and encourage initiating sexual behaviors. However, research from the University of Washington found that adolescents who receive comprehensive sex education are significantly less likely to become pregnant than adolescents who received abstinence-only education. Therefore, sex education curriculums should be mandated to teach about consent, the risk of pregnancies, and how to practice safe sex. Reproductive rights in Texas are important because currently there is a state movement to ban abortions. This creates a challenge for Texas women to be able to safely obtain abortions. Recent studies estimate that banning abortions in the U.S. would lead to a 21% increase in the number of pregnancies-related deaths overall. Some conservatives argue against abortion for the preservation of life. However, they fail to consider that 90% of abortions are done to save the mother's life. Furthermore, mothers who survive and keep their children are likely to be in poverty. By legalizing abortions, we can decrease the amount of women's deaths and lessen the strain on the economy by reducing the number of families on food stamps and other welfare programs. Women not having to give up their careers will also contribute to the economy. Furthermore, preventing women from being forced into motherhood raises the quality of home and child care and lowers the risk of child abuse. In conclusion, in Texas, it's important to create laws mandating a comprehensive curriculum of sex education that includes safe sex practices for all genders and identities, because it leads to the prevention of STD spreading. Furthermore, teachings on consent and pregnancy in schools can reduce the number of women's deaths, as well as providing women the choice to get an abortion past the first 6 weeks in Texas, because it contributes to a better economy and future generations as it lowers the risk of child abuse.